On Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Nermeen Sheikh as we go to Philadelphia, where we're joined by Dr. Paul Offit, professor in the Division of Infectious Diseases and the director of the Vaccine Education Center at the Children's Hospital of Philadelphia. Dr. Offit is also professor of vaccinology and a professor of pediatrics at the University of Pennsylvania School of Medicine, also the co-inventor of the rotavirus vaccine, RotaTeq, recommended for universal use in infants by the CDC, author of numerous books, including Autism's False Prophets, Bad Science, Risky Medicine in the Search for a Cure, and Deadly Choices, How the Anti-Vaccine Movement Threatens Us All. Well, Dr. Offit, you have heard our show today. Can you talk about why you feel vaccines are so important?
Well, because they saved our lives. If you look at how long we lived, say 100 years ago, we lived 30 years less long then than we do today. So the main reason for that is vaccines. We no longer have to see 50,000 children hospitalized and 500 die from measles every year as we did before the vaccine. We no longer have to see diphtheria as a common killer of teenagers. We no longer have to see 20,000 children suffer severe and permanent defects caused by rubella virus, so-called German measles virus. We no longer have to see children die or suffer permanent disability from bacterial meningitis from diseases like meningococcus, pneumococcus, Haemophilus influenza type B. Vaccines, I think, are the single best preventive measure that we've ever had. The problem, as clearly reflected by your previous caller, is that we don't appreciate them. I think vaccines are a victim of their own success, and they're obviously being blamed for things that they don't cause.
Well, what about the issue of the connection between MMR and problems in children? Our last guest, Mary Holland, talked about her own son who ended up with autism, and she feels there was a direct connection between MMR and autism.
I think it's perfectly reasonable for a parent to ask the question. My child was fine, they got a vaccine, then they weren't fine anymore. Could the vaccine have done it? And as Ms. Holland argued, it is a temporal connection, but it's not a causal connection. I mean, there have now been 14 studies done looking at hundreds of thousands of children who either did or did not receive the MMR vaccine, and the results have been clear and consistent and reproducible. MMR vaccine does not increase your risk of autism. All you do by choosing not to get an MMR vaccine is increase your risk of getting measles, mumps, or rubella. You know, what is upsetting to me about this, and I honestly think the last 10 minutes of your program set a new record for consecutive statements that were incorrect, is that when you do the science, when you do these excellent, retrospective, huge studies that answer the question, that people don't believe them. And the reason Ms. Holland doesn't believe them is she's a conspiracy theorist. I mean, listen to what she says. There's this guy who was a fraud, and then there's this whistleblower at the CDC. I mean, there are 14 studies on 3 continents involving hundreds of thousands of children. Is she claiming that there is a massive international conspiracy to hide the truth? I think she is, and that's what makes her, to me, a classic anti-vaccine person.
Well, what about the issue, for example, of the combined vaccine, the MMR, measles, mumps, rubella, and the argument for separating them? And why were they put together? Talk about how vaccines came to be what they are and why they are mandated or not mandated in this country.
Right. So the measles vaccine was developed in 1963, the mumps vaccine in 67. There was the second measles vaccine, the last best vaccine in 68, and then we had the rubella vaccine in 69. In 1971, those 3 vaccines were put together because you could do it safely, as was proven, that when you combine those vaccines, that you didn't interfere with or change the safety profile or immunogenicity profile of those vaccines when they were given separately. So now you had to give 1 shot instead of 3. Now we have a 2-dose vaccine. So that means you give 2 doses instead of 6. There's no reason to separate those vaccines out because all you do by separating them out is increase the number of shots without in any way changing the safety profile. In terms of mandates, your question about mandates, I think you're starting to see why it is that mandates are so important. There is no good reason to choose not to get a vaccine. If you're choosing not to get a vaccine, then you're basing it on a misperception or a series of false beliefs, as Ms. Holland has about vaccines. She says, for example, that that vaccines are never tested together. Of course they're tested together. You cannot put a new vaccine on the schedule without proving that your vaccine doesn't interfere with the safety and immunogenicity profile of existing vaccines, and vice versa. Those are called concomitant use studies. Ms. Holland says that there have been no studies looking at sort of relatively vaccinated or unvaccinated children. That's not true. There are several studies that have looked at that, including that of Peter Abbey, which suggests that the highly vaccinated child has better health than the child who is less vaccinated. I mean, Ms. Holland says that the hepatitis B virus is only transmitted by sexual contact. That's not true. Children less than 10 years of age in this country, before the hepatitis B vaccine, 18,000 would suffer hepatitis B. Half got it by traveling through a birth canal that was infected with hepatitis B, but the other half got it from relatively sexual contact, relatively casual contact. You know, those children who were less than 10 weren't getting it from getting tattoos or using intravenous blood transfusions or intravenous drugs, and they certainly weren't getting it from sexual contact. They were getting it from Uncle Bob, who had hepatitis B but didn't know it, who gives them a little kiss. That's how they were getting hepatitis B. So there's so much misinformation out there that causes people like Mary Holland to make bad decisions for her children. If vaccines were unsafe, I think this would be an interesting and reasonable discussion. But vaccines are remarkably safe and remarkably effective, and when you watch herd immunity erode, as it clearly is in this country, we eliminated measles by the year 2000, and now because parents are choosing not to give vaccines based on their false or at least ill-founded concerns, other people are suffering. I think Professor Reiss, who was just spot on what she said earlier, I think said it best. Is it your right to catch and transmit a potentially fatal infection? I think the answer is no.
But Dr. Offit, can you explain how it is that so many parents came to make an association between vaccines and autism, given all of the scientific research and the studies that you cite? Is it because such a large number of children were suffering after having received vaccines, or what do you attribute this to?
I think it's the analogy could be made for diabetes in the 1800s. In the 1800s, people suffered diabetes, and nobody knew why. And many things were blamed, including vaccines, right? I got a vaccine. Now, you know, within 6 months, my child has type 1 diabetes. I think the vaccine did it. And at the time, it was a smallpox vaccine or the rabies vaccine, which was introduced in the late 1800s. The vaccines are always sort of the universal scapegoat. Then, in 1920, Banting and Best isolated insulin, and all that nonsense went away. I think maybe this nonsense doesn't go away until we clearly have a cause or causes for autism, or I think much more difficult, a cure for autism. Then it'll all go away. I mean, clearly, if you look at the science of autism, it's clearly at least genetic. I mean, we know that it appears to be an in utero event. So I don't think there's any evidence that an environmental influence, especially vaccines, have ever been shown to increase the rate of autism. But, you know, and I think the answer to the question, why is it that people aren't convinced? I think the media is perfectly willing to put the sort of, you know, man bites dog story out there, which is Mary Holland's rant that, you know, that vaccines cause autism, and she knows it because that's what she saw. You know, I'll give you a story. My wife is a private practicing pediatrician. She goes into the office one day, and she's helping the nurse give vaccines. There's a mother who has a 4-month-old that's sitting on her lap along the sidewall. While my wife was drawing the vaccine up into the syringe, the 4-month-old had a seizure, went on to have a permanent seizure disorder, epilepsy. If my wife had given that vaccine 5 minutes earlier, I don't think there are any amount of statistical data that would have convinced that mother of anything other than what she believed to be true. What do you think? I'm stupid and my child was fine. They came in here, they got a vaccine, now they have epilepsy. I know what I saw, even though it was a temporal association.
I mean, to be fair, we wanted to have both of you on together to have a conversation, because there are many in this country and a growing movement of parents who are deeply concerned. But you wanted to have this conversation separately, Mary Holland and you separately. So it's important to, I think, have this kind of dialogue on all of these issues. Dr. Offit, on this issue of vaccines now being...
Can I just address that?
Yes, sure.
Can I address that for 1 second? I think that it is not important to have a debate about the science with someone who clearly doesn't know the science. I'm sorry, Ms. Holland misrepresented the science again and again and again. I don't think that in any way helps your viewer. I don't think it's fair to have a debate where two sides are presented when only one side is really supported by the science. I'd like to think we're beyond that. If you ask the question, why is it that
Dr. Offit, what I think is important, it's not only about science. We're talking about science. We're talking about the practice of medicine in this country. We're talking about public policy. I mean, after all, this has now become a presidential campaign issue with possible presidential candidates taking on the issues, and I want to get your comment on that. But you're combining all of this, and it's important to bring all the various expertises of parents, of lawyers, of doctors together in a conversation on these issues.
Right, but what Ms. Holland does is she presumes to represent the science. I actually agree with you. I think we're at a tipping point, and I think the critical discussion now is the one that was brought up by Professor Reiss, which is, how far do we go here? I mean, I happen to have survived the 1991 Philadelphia measles epidemic. I was a doctor at Children's Hospital of Philadelphia. During a 4-month period in Philadelphia in 1991, we had 1,400 cases of measles and 9 deaths. And it centered on 2 fundamentalist churches that chose not to vaccinate their children. We got to the point of compulsory vaccination. And believe me, no one in Philadelphia had a problem with that. It was, people were so scared of that disease because it was so common and so fatal that we got to compulsory vaccination. By that I mean those children in that school who were unvaccinated were made wards of the state, vaccinated, and then given back to the parents. And the American Civil Liberties Union, who is perfectly comfortable representing pretty unpopular causes, never stepped in. They were asked to step in by Charles Reinert, who was the pastor of one of those churches. And remember, there was a religious exemption to vaccination on the books for 10 years at the time this happened. And the American Civil Liberties Union said, while we believe it is your right to martyr yourself to your religion, we don't believe it is your right to martyr your child to your religion. And I give the ACLU credit for that at the time, but you had to be here. I'm not sure they would feel the same way. How bad does it have to get before you say, you know, it is your right to swing your fist wildly, but that right ends at the tip of my nose? And I think that's what's true here. We were offended when that man got on a plane with tuberculosis and was coughing and had, you know, so-called multi-drug resistant tuberculosis. We thought he had done something that was awful. And I think this is no different. I don't think it is your right to expose your child needlessly to infection and to expose those with whom they come in contact needlessly with infection.
So,
and if vaccines were a safety issue, I would get it. But it's not. They're remarkably safe. What
about the Vaccine Compensation Board? Talk about what that is all about, how families get compensated.
Yes. So in the early 1980s, there was born the notion, which was since refuted by scientific study, that the whole cell pertussis or whooping cough vaccine caused permanent brain damage. It was a documentary that was made by Lee Thompson, a veteran newsmaker from NBC, called DPT Vaccine Roulette, and it showed a series of children who supposedly were permanently brain damaged by pertussis vaccine. Now that was wrong. Study after study showed it was wrong, but it was a vivid image, and it brought a ton of litigation against pharmaceutical companies that made vaccines to the point that they were out. I mean, they weren't going to make vaccines for American children anymore because they didn't want to have to fight all this in civil court based on a false notion that vaccines were causing permanent harm, and you know, juries were perfectly willing to side against the pharmaceutical companies. And so what was put in place was the National Childhood Vaccine Injury Act in '86, which became the Vaccine Injury Compensation Program in 1988, to basically give people who may have suffered a permanent harm from a vaccine compensation. Fair enough, but that is not the place to determine scientific truths. I mean, so for example, there was a rotavirus vaccine that was introduced in this country in 1998. It was on the market for a year. It was found to be a rare but real cause of intestinal blockage, something called intussusception. I think parents were fairly compensated for that because I think if we're asking our citizens to give vaccines, there should be this sort of compensation system. But believe me, there are many compensations in that program that are wrong. I mean, they have compensated people for multiple sclerosis caused by hepatitis B vaccine when it clearly doesn't do that, and 2 New England Journal of Medicine studies show it, though, which is to say that the courts are not a place to determine scientific truths. Scientific studies are the place to determine scientific truths. The courts are simply a place to settle disputes. Lawyers shouldn't be making a decision about whether or not one thing causes another. I think that's the province of scientists and academicians.
We have 10 seconds.
Dr. Offit, yeah, just very quickly before we conclude, do you think that there should be compulsory vaccination across the U.S. now?
I agree with Professor Reiss. I think we should certainly, as a first step, make it much more difficult to get a philosophical or religious exemption, both of which, as far as I'm concerned, are misnamed. I mean, philo, love, sophos, wisdom. Where's the wisdom? It says, sorry, and you know, it's an unreligious act to get to not get a vaccine. But I think we should make that harder. And yes, I think eventually we should make it so that you pay some sort of price for doing something to put your child and other people at risk.
Dr. Paul Offit, we thank you for being with us of the University of Pennsylvania. I'm Amy Goodman with Nermeen.